Hello, everyone. Today we continue looking at the expanded program of immunization. Okay, before we recorded this lesson, we had done a lesson on cold chain. So these topics are highly related. So before you actually listen to what we have on the expanded program of immunization, I would encourage you to also watch our cold chain program, and then you can come to this lesson. So my name is Jones, and we can continue. So, review of immunology. Okay, by definition, immunology is the study of how the body protects itself against invading pathogens and harmful cells or substances. That is what is meant by immunology. All right, so now let's look at the functions of the immune system. So, the basic functions actually may include the following. Firstly, is to protect the body from harmful effects of viral, bacterial, fungal, and parasitic pathogens and their toxins. Secondly, we look at the function of the immune system as to destroy abnormal cells which may form in the body cells, such as cancer cells. All right, our third function of the immune system and the basic function include to prevent abnormal breakdown of the body's own tissues. All right, so the immune mechanism. So the body's immune mechanism consists of one, non-specific natural immunity, two, specific acquired immunity. Let's understand what we mean by non-specific natural immunity. This is a type of immunity one passes simply by being human. That is, we are looking at the non-specific natural immunity. So, what we are saying here is that we are born with this mechanism which protects us from infections and harmful pathogens. And it includes one, physical mechanical barriers. For instance, the skin, mucous membrane of the respiratory tract and genital tract, hairs in the nasal tract and the lining cells of the gastrointestinal tract, which provide barrier against invading microorganisms. The second part of this is the chemical barriers. These contain antibacterial substances like gastric juices, sweat, saliva, tears, and human milk. So they have these chemical barriers that are able to protect us against bacterial substances. The third one is the process of phagocytosis. This is a process in which a cell called phagocyte engulfs and destroys an invading pathogen. Phagocytes are like cleaners in the body. And number four, genetic factors. So this influences how susceptible and resistant someone is to certain pathogen. Now let's look at specified acquired immunity. How does this work? So in this type of immunity, there is a specific immune reaction against a foreign antigen, which may be an invading organism, harmful cells, or toxic substances. Acquired specific immunity reaction involves two components. So number one, human immune response. This is the production of specific antibodies which circulate in the bloodstream and react specifically against antigens causing their production. When we say antibodies here, there are immunoglobulins like immunoglobulin D, that is immunoglobulin IG, which react specifically with antigens. So immunoglobulins are produced from B lymphocytes or B cells. Let's look at types of antibodies. So we have immunoglobulin G. Immunoglobulin G, the main antibody which binds to foreign antigen at a later stage of the primary infection. It crosses the placenta barrier and therefore constitutes the main protective antibody for an infant to about 6 months. Okay. So then we also have immunoglobulin M, IgM, antibodies which provides this is an antibody which provides early but short-lived antibody response in primary infection. Hence, any rise in immunoglobulin indicates presence of recent infection. Immunoglobulin A. This is found in secretions of the eyes, nose, mouth, bronchi, and intestinal tract. They are locally active neutralizing toxins and viruses. Immunoglobulin D. This immunoglobulin is present in the body in small amounts and is known to be active against foreign antigens. So raised immunoglobulin D is found in AIDS patients or common chronic conditions. Immunoglobulin E. This immunoglobulin is present in the body in small amount and is also found in mucous membranes. This one is responsible for hypersensitivity reaction and is present in more amount in asthmatic patients because they are highly sensitive. All right, let's now move on to number 2 of the specific immunity. Cell-mediated reactions. This is well sensitized, that is exposed to antigens. Immune cells called T lymphocytes and macrophages directly attacks intracellular pathogens, tumor cells, or other foreign tissues. All right, so we are done with we're looking at trying to go to the slides just before so that I can be with you on the same page. So we're looking at the non-specific natural immunity and the specific acquired immunity. Then we discussed the non-specific natural immunity, and we said it includes physical, mechanical barriers, the chemical barriers, and the process of phagocytosis. And the fourth part was the genetic factor, which influences susceptible and resistant that someone is to a certain pathogen. Then when we looked at the specific immunity, this type of immunity, we said that there is a specific immune reaction against a foreign antigen. Okay, so acquired specific immunity reaction, we said, involves 2 components, and these components are human immune response and human immune response. On human immune response, we have looked at immunoglobulins. Okay, so immunoglobulins M, IgA, IgD, IgE, and then the second one was cell-mediated reactions. Now we are moving on to look at types of cells. So we have natural killer cells. Natural killer cells are capable of causing direct damage to tissue cells infected with viruses by direct contact, that is both cell and pathogen. We also have macrophages. These cells are able to ingest and kill certain bacteria and have them removed from the bloodstream. And unwanted debris also damage antibody are also coated on the cells. They can also be removed. They can help us to remove or clean all these. Then we also have neutrophils. So they are phagocytic cells that are highly mobile and predominant in acute infection. Okay, then eosinophils. These are involved in anaphylactic allergic reactions. When someone is having an allergic reaction, the eosinophils are raised. So acquired specific immunity is usually described as passive or active. What do we necessarily mean when say active or when say passive? Okay, let's look at the word active, what it means. So this is inactive acquired immunity. That is inactive acquired immunity. The cells of the immune system recognize a foreign antigen, react specifically with it to bring about its destruction, inactivation, and record information about it. The recorded information provides a memory of the invading organism or other foreign antigens so that the next time it is met, the more rapid response will occur in order to contain the infection. So active immunity occurs naturally when the body is exposed to infection, or artificially when the body is stimulated to produce antibodies by use of immunization. All right, now let's also look at the other term that we used, which is passive. So in passive acquired immunity, antibodies formed in a normal person or animal are introduced into the body of a non-immunized person and offer that person protection for a limited period of time. Passive immunity occurs naturally, for example, during pregnancy, when antibodies cross the placenta, or when we are transferred in breast milk when they are transferred during breastfeeding. So you are offered what we call passive immunity. So the antibodies protect the baby during the first few months of the life until it begins to form its own antibodies. So the baby gets to benefit from the passive immunity from the mother when the mother is breastfeeding. It may be done artificially, e.g., also when a person receives antibodies or gamma globulins in the treatment of diphtheria, tetanus, or snake bites. All right, so now tissue of the immune system. The organ tissues involved in the immune system includes the bone marrow, the thymus gland, lymph nodes, and the lymphatic vessels. The spleen, lymphoid tissue on the tonsils and adenoids are also involved in the immune system. All right, so now we move on to understand the expanded program of immunization. All right, Zambia has adopted the goal of child immunization. This goal is meant to ensure that all children from 0 to 5 years receive the up-to-date immunization to protect them from diseases. A fully protected child is one who has received BCG, measles, 3 doses of DPT, Hib and HPV, IPV, and OPV doses by the age of 24 months. So target group of immunization includes the following: children under 5 years, school-age children, pregnant women, and women of childbearing age, that is 15 to 45 years. All right, so when we mention the fully protected child, being that one who has received the BCG, measles, and the likes, all these diseases, we find them, all these immunization, we find them on the under 5 card. All right, so now the schedule of the child immunization in Zambia. So I have here a table that has got a column for vaccine, minimum age, number of doses, and the minimum interval between the doses. So BCG is given at birth or on first contact. Number of doses is 1, and the minimum interval between the doses nil. OPV 0 is given 0 to 13 days. Number of doses is 1, and minimum interval between doses is nil. I would also like to make mention here that by the time we are recording this lesson, certain things may change because immunization schedule keep on changing because of other vaccines that may be brought on the market. So this is based on what is happening currently as I am presenting. So we have OPV 1, 2, and 3 that are minimum age for giving is 6 weeks, and number of doses that the child will have to receive for this is 3, and minimum interval between the doses is 4 weeks. DPT, Hib, and HBV 1, 2, 3 are also given at 6 weeks, number of doses 3, and minimum interval between the doses is 4 weeks. Measles, on the other hand, we have measles that's given at 9 months, and number of doses is 1. Minimum interval between the doses is nil. But if the child has to receive measles second dose vaccine, this has to be between 15 or 18 months. Number of doses will be 1, and the minimum interval between the doses will be nil. OPV4, when OPV0 is missed, it will be given at 9 months. Number of doses will be 1, and minimum interval between doses will be nil. Another vaccine that was introduced on the market, that is the Rota vaccine, is given at 6 weeks. Number of doses is 2, and the minimum interval between the doses is 4 weeks. Pneumococcal vaccine, PCV, PCV10, that is given 1, 2, and 3 doses. So the minimum age is 6 weeks. The number of doses that the child receives is 3. And the minimum interval between the doses is 4 weeks. All right. So please, I would encourage you to know all this information. It is found on the under 5 card, and you can make reference. Now, let's look at adding pneumococcal conjugate vaccine, that is PCV10, to childhood immunization schedule. We said at birth, BCG and OPV0 can be given. See at the column of age and the column for vaccine. So we said at 6 weeks, DPT, Hib, and Hep B1 or PV1, they can also be given vaccines there, and we have the PCV10-1 given. At 10 weeks, we have DPT, Hib, and Hep B2 that are given with OPV2, and PCV10-2 dose is given. At 14 weeks, we have DPT, Hib, and Hep B3 and OPV3 that are given. PCV3 also is given. Then at 9 months, we only have measles that is given. So second dose of measles would have been given at 18 months, if at all at 9 months it was not given. All right, so that is the schedule on how it is given with a 4 weeks interview, for 4 weeks interval. So at 6 weeks, at 10 weeks, at 14 weeks, then vaccines are done there. Remaining the one at 9 months, which is measles. All right. Vaccination schedule at school entry. I have a diagram with column for age and the column for vaccine. So at school entry, BCG booster, if the child does not have a scar, it will be given. Also at school entry, measles, if no record of previous vaccination, has to be given. At school entry, tetanus toxoid is also given. So this is the vaccination schedule at school entry. Now, schedule for tetanus toxoid. This is from mother of childbearing age, 15 to 45 years. I have a column for tetanus dose and contact. So tetanus dose, TT1 is given at first contact or early during pregnancy during the first trimester. Then TT2 is given at least 4 weeks after TT1. TT3 will be given at least 6 months after TT2 or during subsequent pregnancy. TT4 at least 1 year after TT3 or during subsequent pregnancy. TT5 at least 1 year after TT4 or during subsequent pregnancy. After getting the TT5, tetanus toxoid 5 vaccination, it means the mother is now fully protected from tetanus. All right. So tetanus toxoid, each TT or tetanus toxoid given should be recorded in the woman's card. Doses received during pregnancy should be recorded on both the woman's TT child or maternal card. If the woman reports having received 2 doses of TT during previous pregnancy, start counting from TT3, even if no record of the 2 doses of TT are shown. Here we have vaccines and how to administer them. We have a column for vaccine, the dose, and the recommended way of administration. So BCG for less than 1 year, we give 0.05 mL, and it's given on the outer aspect of the lower arm. Above 1 year, we give 0.1 ml and it is given intradermal. OPV, on the other hand, the dose is 2 to 3 drops. It's given orally. So I understand this time we have polio vaccine that is injectable. So you can always update yourself with how that is given. DPT, Hib, and HPV 0.5 mL is given on the left thigh intramuscularly, IM. Measles 0.5 mL upper left arm, that is on the deltoid muscle, is also given. Remember that we just said that measles second dose can be given at 18 months, and it's not necessary, if at all it was given at 9 months, to give it between 15 to 18 months. Tetanus toxoid 0.5 mL IM, that is on the deltoid muscle, the upper arm, is also given. Then we have other vaccines like the rotavirus vaccines, pneumococcal vaccines, and HPV vaccines that can also be given. Side effects of vaccines. Vaccines for routine immunizations are among the safest and most reliable drugs available. However, minor side effects do occur following immunization, and rarely a serious reaction may restart from a vaccine or may come from administration of vaccine. When we talk about DPT, Hib, and HBV, the inactivated antigens such as DPT, side effects are most likely to occur within few hours or days of administration. So the side effects include tenderness, swelling at the site of injection, low-grade fever, behavioral changes such as drowsiness, loss of appetite, and prolonged unusual crying. So Hib and HPV vaccine may be associated with low-grade fever, and later complication of confusion may be seen. BCG. This can form an abscess under the armpit or near the elbow. The side effects can be due to an sterile needle. Injection maybe went too deeply by mistake. A large dose was given and strength of the vaccine might be too high. Okay, maybe mistake from the manufacturer and the like. Such things may happen later. OPV. This is a live attenuated virus. Unfavorable reaction and vaccines-associated reactions may occur from a period of 30 to 60 days after the vaccination. No side effect usually, but low-grade fever might occur when you are given OPV. Measles, on the other hand, which is also a live attenuated virus, side effects are mild and includes fever and a rash. The nursing implication for giving the measles vaccine are that you need to tell the mother that the baby may have fever for 1 to 3 days or a week after the vaccination. Sometimes the baby might have mild measles rash. So it's important that you reassure the mother that the rash is much milder than the disease and may go away on its own. If the fever persists, the mother needs to report to the health center for intervention. PCV10, that is, protects against invasive disease caused by pneumococcus. Pneumococcus is a pneumonia, septicemia, meningitis, and others, like otitis media, tonsillitis, sinusitis, and skin infection. So route is IM, and 2 doses Vulcan are used. 2-dose Vulcan used. So no adverse effects after immunizations are mostly seen. So it was introduced in the Zambian market in 2012 in Zambia. That's when it was introduced. And then the rotavirus liquid vaccine protects against rotavirus that causes diarrhea. The dose is single-dose vial. Orally, 2 doses are given. The vaccine is actually very safe. Age is at 6 weeks and at 10 weeks. That is when it is given. HPV. Two vaccines are now available: Civerix and Garcia. Adolescent immunization, that is being introduced in the extended program of immunization program discussion, which was underway from 2014 to 2015. And then the second dose of measles at 15 is also under discussion as to whether it is necessary in terms of outbreak or as a routine. So children of childbearing age, before they may start receiving HPV vaccine, and second dose discussion also underway as to whether it can also be put as a routine. Tetanus toxoid. Side effects include mild pain, redness, and swelling. These side effects are common a few days after vaccination, but it's important you as a nurse or as a health practitioner to assure the woman that side effects go away on their own. Hence, when we say nursing implication for immunization to avoid side effects, it's important you select a muscle of adequate length to deposit the vaccine deep in the muscle. Use the right site for the right vaccine. Explain possibility of minor side effects to the mother or the caregiver. Paracetamol for minor headaches or fever following vaccinations are also recommended. If the child convulses after receiving DPT, he or she should not receive any DPT dose or doses. Contraindications to immunization. Anaphylactic reaction to the vaccine may necessitate a contraindication. Moderate to severe illness with or without fever, that is in symptomatic HIV/AIDS or vaccines, can be given except BCG and yellow fever. Please, it's important you know that for moderate severe illness with or without fever, symptomatic HIV and AIDS or vaccines can be given except BCG and yellow fever. Remember, no contraindication, that is for minor diseases like diarrhea, fever of less than 38, and upper respiratory tract infections. So allergies like asthma, family history of convulsion and the likes does not necessarily mean a contraindication. Prematurity, malnutrition, small for gestation, age infant, chronic diseases of the lungs, liver, and kidney, localized skin infection, and history of jaundice and Down syndrome. Immunization strategies. Strategizing. This refers to methods of providing immunization. So we have strategy A, which is done as a static unit. Strategy is carried out at all health services and health facilities that offer maternal health. You should know that services are provided within 12 kilometers of the people that the clinic or health center is servicing. So the static unit, it's called static unit because clients are coming to the health center. That's why we're calling it a static unit. The parents, guardians, these children are bringing the child to the health center. Strategy B, mobile unit. In this strategy, it helps to provide health services to population living outside the 12-kilometer radius from health facility. This is carried out on foot, motorcycle, vehicles, or by water, or by using canoes, which we have used most of the time to reach far-flung areas where road network is poor and you have just a river. The outreach should be provided in such a way that it covers a target population within such period of time and within available resources. The community should be involved in the planning for outreach activities. You cannot go to immunize without telling the community that on such and such a day you are coming for immunization. You go there, you find one child, or you may not find a child at all. So it's important you set dates, let the community leaders there mobilize the children, find out the number so that when you're going there, you are well prepared. Strategy C, school health services. So C, school health services. This is aimed at immunizing susceptible children against measles and giving booster doses of tetanus toxoid if there is no primary scar. And that is no primary scar for tuberculosis. ECG can be given. All children enrolling in grade 1 should present with immunization cards to school administration to check the immunization status. Those children who have missed primary immunization are given a booster dose. Let's look at strategy. This is for women of childbearing age. So women of childbearing age and pregnant women are provided with immunization against tetanus, and this protects the unborn child against tetanus. So it is important that we use every contact to immunize the women against tetanus. So the coaching assignments that I had given you earlier, I've also covered it as a lesson. So this assignment for now may not be valid since I've already taught in the other video that you can make reference, right? And I've already graded. So this assignment has been done. Otherwise, if you're still facing challenges in our Google class and Google Hangout, we can always have a discussion so that we can make a lot of things straight. Record keeping and reporting. We have to ensure that all the vaccines the child has received are recorded in the under 5 register. Every month, numbers of children that have been vaccinated should be sent to the District Management Office, Provincial Management Office, Ministry of Health, and Central Statistic Office. Alright, I thank you most sincerely for following my lesson on the expanded program of immunization. Please, I encourage you to also listen to our cold chain lesson, where we also tackled a lot of things there that you need to look at so that you can benefit. So please, if you have any questions and suggestions of the topics where you might be facing challenges, you can comment below this video link and we can have a Google class on the same.